So today's conversation will explore the progress and the persistent challenges in advancing equity across science and biotech. So from representation in leadership to inclusion in clinical trials and in like genetic therapy we just discussed, we'll trace how far the field has come and where systematic gaps remain and how the current moment shapes our path forward. And at the same time, we'll discuss why equity is not only a moral imperative, but also a driver of stronger science and better innovation. And our goal is to leave you both inspired and equipped to be part of building lasting change in our ecosystem. Today, we are honored to have key stakeholders in the field to join us and discuss the topic. So I'll let the panelists introduce themselves, and to get us started, I would love like every panelist like to briefly introduce yourself and share with us at the end like what equity in science means to you. How about that start with Reggie?
Oh, I thought it was going to be ladies first, but I'm happy to get the project, this rolling. So Reggie Swift, founder CEO of Rubix Life Sciences and several other companies, but my focus for Rubix Life Sciences is to be a engine, if you will, right? Yes, although technical term is CRO, we want to be able to design, not just design, but also have forward-thinking evidence around generating therapies that actually can mold our N=1 model for patients of many descents, right? So that we don't have to do without, so when we talk about access issues or therapeutic areas where there's opportunities where perhaps there aren't a lot of individuals of, people of color in underserved neighborhoods included in trials, well, we can actually try to get them involved and we can actually generate evidence and we can actually have tie-ins directly from early stage research all the way to healthcare delivery, right? And that's really our design, and we want to continue along that path. And obviously, that takes many hands make light work, right? So just like my counterparts here on the panel, we work with them to make sure that happens, right? So honored to be among the stars with this panel and happy to have the conversation.
Thank you, Reggie. And how about that's passed to Tamar?
Thank you, Megan. Great to see everyone here today virtually. My name is Tamar Thompson, and I am the head of patient experience and insights for Alexion AstraZeneca Rare Disease in my day job. And what that means, I guess, pulling through for those of you who are on the last panel, is rare disease is what I do all day, every day. So it was refreshing to hear some of the comments about genetic testing. I popped in 10 minutes before the close, and I wish I would have been able to make the entire thing. I guess that's what the recording is for, so I'll be able to go back and see it. But in my day-to-day, thinking about equity is this. In rare diseases, there are 10,000 unique rare diseases, 400 million people around the world that suffer from a rare disease. Yet 95% of those patients don't have an available treatment option. And that's not because they live in a singular zip code or postcode if you're going global. It's because they have a rare disease, right? And so for me, equity is about representation in the journey to ensure that we are counting all rare disease patients in that journey from diagnosis, which takes anywhere from 5 to 7 years, which also then, and so, pulling that back toward the conversation on genetic testing. So newborn and screening is important. As we advance to genetic testing, super important. Want to give a shout out to RADI and some of the work that they've been doing around, next gen sequencing and whole genome sequencing in the rare disease community. So for me, it's about representation and making sure that all the voices in the rare disease community are heard. And that includes everyone, Black, Brown, or other. So I think in the US, we tend to emphasize communities of color or communities within certain zip codes. But in the rare disease space, we're all inequitably served. Every patient in this space is inequitably served. And the science is there. We're in a place where the science is incredible. We just heard from Jimmy, who received, gene therapy for sickle cell. So the science is absolutely there. We just need to bring the access along so that we can start to innovate more for this patient population.
Totally. And our last panelist, Malaika.
Hi, everyone. Malaika Lucien. I work for the Secretary of Education for Massachusetts as the STEM policy lead. And as part of that work, I help coordinate the whole range of our STEM initiatives from investing in K-12 curriculum to our higher ed institutions, and then our workforce development. And I'm really excited to be with all of you here today. I have an untraditional path to science. I didn't necessarily see myself as a career professional in STEM when I first started out. I got my first job in politics, and eventually got a job on the governor's campaign, Governor Maura Healey, where I did legislative affairs after the political department in the campaign. And as we have that 30,000-foot view of where we can really make influence, I was drawn to the education department, and particularly STEM, because it is such an intersection between our priorities for economic development and then our health and human services departments. And through that work, I've been able to participate and amplify the very important work happening across STEM and across science here in Massachusetts. And for me, as a public servant and as a first generation American, my parents are from Haiti, I really see STEM as a vehicle to address some of the historic inequities that exist across our government, across civic society, but also a path for us to really realize the promise of the American dream, where everyone has that opportunity to make a life for themselves and to contribute to our communities. And I see very pointedly how having a diverse group of people involved in science really contributes to innovation and making it well-rounded and well-informed. So really excited to be here with you all today.
Thank you, Malaika, and thank you all for sharing your equity in science mean to you, as this set a perfect foundation of our next coming questions. So to start off, kind of to bring our audience some background information. So for decades, representation at a leadership level in academia, industry, and policy has been limited. So could you share with us what progress have we made and where do the gaps remain most urgent? And we can start this with Tamar.
Oh, okay. So, I mean, listen, I think, if we're talking about leadership, then women represent, 50% of this planet, maybe 51, and not always well represented at the leadership table. And that creates back to a representation problem in the science. It's around, making sure that you have people there who can understand the population that you're looking to serve. And I will, just point to maybe, women's health. Right now, it seems to be having a little bit of a movement. I choose to believe that that is in large part because there are a number of women in science who have achieved leadership positions to where they now have a voice to amplify, and not just in science, quite frankly. When we look at, Malaika, your boss's boss, the governor. So when we look there, Governor Healey has done an amazing job at pushing forward science through her role from a political standpoint. We have many women governors right now in other spaces that I think understand the unique needs of women and women who are aging. So not just focusing on, certain populations of people that are, the young and of childbearing age. I look back at my own, parents' journey and my mother and my aunts and going through menopause and, what access they didn't have to information. And now I'm so fortunate to be in a generational time where, you know, everybody is on every talk show talking about this openly. So I do think that the part of the challenge of leadership is it's about representation and just making sure that the populations that you choose to serve in whatever scientific field that is, that you have those voices to be heard, so that you can understand where the pain points are. This happens also in, you know, in rare disease. Often we look at a disease state and I think, you know, from the science perspective and the marketing perspective, we're going one way, but then when we bring the patient community and their caregivers in, we look at things a completely different way, because what's important to the patient population or to whom is, you know, being represented may not be the way that you inherently look at it. And so I would say just starting there, it's about, you know, having voices at the leadership table. And that doesn't necessarily mean the person who's driving the project, but the amplification of those voices at that table to inform strategic decisions and way forward.
And if I could just piggyback off of what Tamar said, I think ultimately it's in every field, it's about building a strong bench. And we are just now realizing and seeing the success of people who were the first of their kind or the first at their school who was a person of color from a historically unrepresented community. I think about like Dr. Kizzy Corbett at Harvard. She's a Haitian woman, so we celebrated her. But as we are in this phase, one of the benefits is that we're starting to have more visibility about people from all types of backgrounds being involved at the leadership level, but also normalizing that for our younger generations. And how do we make that more accessible to them so they see themselves as a person who can pursue a career in science or in health or health and human services and beyond. And I think the charge for us is how do we amplify and increase awareness of those career opportunities, and how people can use their particular backgrounds to innovate and come up with really cool science experiments. And we have to start really young. Here in Massachusetts, we've seen science fair participation in sixth grade as a really critical indicator about whether or not a student continues in high school pursuing their interest in science. And so how do we create after school opportunities for that curiosity to persist throughout their education and academic career? And then also, how do we raise awareness for their parents and guardians about opportunities for them to cultivate the interest? Because if you don't have like a parent or a family member who has a STEM career, you'll think it's just being a doctor, and all of these different career pathways exist. And there's also a whole career they could have after the fact, right? And so I really just think it's about amplifying the strong bench that we have now and then prioritizing that moving forward so that we're actively reinforcing these careers in STEM that might not have existed if you didn't know know a person in your network. And so how do we create those opportunities organically?
And I want to piggyback off of both of them. And I think it's always about exposure amplification, right? And what I kind of tie that into is because the next breakthrough for all mankind can actually come from women's health, right? And we're fragmenting and we're just, isolating the cause where women's health is, everyone's saying women's health is having this moment, but no, women's health is actually for everyone, right? We've actually uncovered mechanisms in where specific identities in Nepal, right, from women actually have specific biomarkers that we can actually start using to treat prostate cancer, right? So these are things that we have to realize, hey, everybody has to have synchronicity to say maybe that one person is realizing that they have an idea who's in sixth grade right now that they want to be able to help support. And what are we doing for that exposure management so that there's a path from getting from there to high school to college to then industry and then to executive level, so that that formation or that identity continues along the next generation of thinkers, right? And next generation of not just the scientists, but also the people who are holding the purse strings, right? And the ones who are funding the research, right? And it all starts from here, right? So I think that we're all having a moment, right? And we have to be allies to help support the generation to come, right? So if we can push that boulder away and push it down the hill, and if we have the strength to do it, I think we continue, right? And then we lift others up as we climb.
Love these ideas. Those are indeed very important. And kind of building upon that, we were wondering like equity also extends to who participates in science, not just who leads it. So here I kind of want to focus on how do we ensure that clinical trials, research studies, and product development reflect the diversity of patients who will ultimately benefit.
Well, I think it, to your point, does tie back into that previous question about, how do we increase representation and leadership, but also, acknowledging that there is a history of medical mistrust that does exist in historically underrepresented communities or folks who don't necessarily have a direct connection to science and clinical trials and that experience. And so, how do we address that as part of our outreach? And we think about the COVID vaccine, and it was very challenging to do outreach at the time to certain communities because they just have a history of mistrust and I don't want to be experimented on. And you think about the Tuskegee experiments and how that has internalized itself in different communities. And so part of the charge in increasing leadership across academia also results in having a real relationship with those stakeholders and then getting them involved so they know this is how we contribute and participate as community members. And it has such a wide benefit beyond just getting treatment for yourself, but making sure our entire ecosystem is healthy as well. And I think when you address it from that perspective of love thy neighbor, then you will actually increase participation from people who wouldn't have otherwise thought to be a member in a clinical trial.
Yeah, I agree. I guess if I can just maybe piggyback onto that and talk about that, the equity in clinical trial and studies, and maybe pulling through something from what Malaika said, as well as the last panel. I think that right now, the data that informs our decisions around safety and efficacy and, comes from a very narrow slice of the pie of the population. And so that representation or the lack of thereof of diverse representation in clinical trials means that we risk the fact that we don't have treatments that might not work as well in certain populations or don't work at all for certain groups of patients. So that's not just really a scientific gap. It's an equity gap. And I think in industry, we have a responsibility to design studies that are, just inclusive by default. It's not something that we have the luxury of thinking of as an afterthought, right? We have to be intentional about who we recruit and how we build trust in underrepresented groups and communities, and how we, remove those barriers to participation. And it's not just aspirational in our world. In rare, we have to do this every day, right? We have to be mindful because you're looking at a specific disease state and you're looking at, a specific population of people. So it's not just, an aspirational thought in the rare community, but, ultimately diverse representation in science it's not about the right thing to do. It's about driving better outcomes and better access and, confidence in treatments that the patients rely on. So that would be, what I would offer from that perspective.
Yeah, no, absolutely, completely with Tamar and Malaika as well. So the way that we always think about it here is asymmetric design, right? We have to do more in order for us to get some, right? So we know that we're going to have to push more towards delivery and patient centricity and concentricity, meaning we're going to have to help develop services so that they can know that we're here for them and not trying to have a transactional relationship. It's more designed to have relationships, longitudinal relationships, so that they know that we're here for them, so that they can see people like us doing research for studies on cancers and diseases and illnesses for people like us, right? So that it doesn't become isolated, again, to that word isolated, where they feel as if that their voice are just going down a hole, right? And, if and to Tamar's point, rare disease has to think about it by default, right? And if we can incorporate that type of methodology into not just oncology, but also just common illnesses, right? I think we can have a industry default where that just becomes commonplace. We're not talking about health equity 10 years from now. It's just really embedded in the infrastructure of how we think about clinical research moving forward. It's just really how do we design approaches to care for these groups, afterthought, right? So that it doesn't become a gap later on where we can create systemic changes. We can create the systemic designs and asymmetric designs where we're caring for them more than they're caring for us, right? So that it no longer becomes transactional, but more relationship. So then pharma becomes much more trusted in the future. And then we're thinking about N equals one treatment rather than, spray and pray.
Exactly. It's very exciting to hear that there are so many possibilities and approaches that we can take to reach our very great mission of really benefiting the patients. But since like right now we are kind of in a complex moment, so how do we keep advancing this work in ways that build consensus and remain effective?
I guess I would offer that, in science, we can't afford to look at, some of the, the political environment and other, complexities that are out there. And I just will liken this back to a rare disease, right? From our perspective, I mentioned earlier that more than 90%, 95 or so percent of our patients don't have an approved treatment option. So by definition, that means that they're all treated inequitably compared to, as Reggie said, oncology, cardiovascular, other, chronic diseases where many therapies exist. Our patient population is just looking for one, treatment option, and that is innovation. So I think that, this really makes representation and research even more urgent for my population because, and keep in mind, my population is 400 million people around the world, which is more than oncology and cardiovascular, or HIV combined. So, that's not an insignificant population of people to be representing. But if diverse populations aren't included in our studies, then these inequities compound because as just piggyback on something Reggie said earlier, with the women's health having a movement and that data and information being useful to other populations of people will remind everyone that oftentimes new and innovative therapies start in rare disease, right? Like we talk about gene therapy, like what better patient population to have started that journey on where 80% of rare diseases are thought to be genetically predisposed. So if you're looking at studies and populations for how genetic testing can be used in more broad spaces, it would make sense to start in rare. And that representation and equity are not just, optional. So they're central to delivering the innovation and access, in my mind, and trust that we talked about earlier that patients deserve.
And I would also want to just piggyback off Tamar, I think, about her point around having accurate information. And so when we think about equity in science, it really is about just the apolitical nature of equity in science and how we are able to communicate the distinction of the work that's happening, whether it's in health inequities, but also as it trickles down to all of our communities and how we interact with the world. Because of the job that I have here Massachusetts, I'm able to ensure that I'm able to advance business development and workforce development. And that is an equity issue in and of itself, and making sure that everyone has access to the jobs that we're investing in as we see differences in labor trends and in the workforce changes that are happening with technological advancement. And so I think trying to center the work in how we interact with each other, how we interact with the world is how we move forward and not let ourselves get distracted sometimes by the highly politicized nature of equity when we think about science, because ultimately the world is changing and we have to adapt to those changes, whether or not we want to get into the political aspect of it. And so part of this work is acknowledging that and moving forward so that everybody has a chance to benefit from the changes and the adaptations that we're working on across our different fields and spectrums.
Yeah, I mean, I don't know how much more I can add to that. I mean, everyone's kind of taking my wind beneath my wings here. So for me, I believe strongly where to even Tamar and Malaika's point, you want to start with centricity in mind, you start with rare disease because you have to think about all the environmental factors and social economic factors and even just biological factors on how a therapy, not even just n equals one, but just how a therapy comes to bear, right? And if you come with a methodology from maybe you kind of come from academia and say, hey, from a scientific aspect, if we're only designing our approach on just biological design, we're missing the whole part, right? We're missing the whole picture from everything else, right? So it has to be designed in a way where we're thinking about much more factors than because we're looking at disease morphology and we're seeing the changes in immunogenicity that happens in every generation. We always have to include all the next generation, and that includes everyone else in that next generation. So if we keep forgetting about the next generation and those people in that generation, well, guess what? These therapies are going to just remain stagnant and not really move the needle. Although we'll say it is, but the FDA will say, hey, no, it's not here and give you a CRL. And then, we're all in the same position as we are today.
Totally. It's very inspiring to hear that there are a spectrum of like different roles and different efforts are now driving the impact. And I'm collecting a question from the attendee that if people want to get involved at changing the policy and population's understanding of why is science is important, what role is a good start would you recommend?
Ooh, yay. I think Malaika is going to have to take that one because I am no longer leading corporate affairs. I'm patient advocacy and experience.
I would say community services is the best forum, right? So I mentioned earlier the sixth grade science fair participation drop-off rates. And so as part of my job, we have 9 STEM regional networks here in Massachusetts, and we fund through the state budget some money for them to organize programming, STEM week initiatives, and they're always looking for volunteers across different industries in STEM to connect with people and their young people. So it's everything from, giving an hour of your time to host after school hours to help a student on their 7th grade science fair project, or donating equipment, or, being a judge at a science fair. And those small interactions have a very large payoff in the long run to support persistence and stuff. And I think connecting with your local politicians to make sure that they care as well, right? And your experience and your background in informing that work is so important. I've tried to prioritize connecting with people who are actively working in STEM, because I think the policymakers sometimes are so devoid from what's happening on the ground that we can craft something that might not match your needs or that are not going far enough. And so how do you just get involved in that natural process? Because the policy development often takes place behind closed doors. And so we're trying to break those barriers down and do outreach. That's why I'm really excited to connect with Nucleate and get more involved in their work, and then just continue networking to hear what you're experiencing, especially now that we're trying to figure out a new landscape of research funding for NIH.
So if I can't help myself, I'm an industry person. I've been doing this for 20 years. I can't help myself. I will say, listen, since we have a bunch of Massachusettsians on the line here, I want to give a shout out to to Peter Kolchinsky and to RE Capital and the work that they've been doing through, and Peter Rubin, Executive Director at No Patients Left Behind. So if you really do want to, kind of know the policy lens, they've really taken the playbook of, spending time on Capitol Hill, making time to meet with members of Congress, understand the nuances in a way that as industry people, we maybe not have the ability to do, right? Like I'm limited if I work for a company, whomever else works for a company is limited in what they can focus on. But the, No Patients Left Behind team is really dug into some of the nuances. I've taken some of the calls that they're on with members to talk about CBO scoring and how it's flawed, right? Like, because it does not consider some of the, nuances of the points for connecting the dots to make accurate policy decisions. So I think if you spend some time in that way of looking at, No Patients Left Behind and the work that they're doing, it's very exciting. But also some of the other work that they're doing in this space is communication and, how do you amplify the voice and the message? So I'll just leave it there, but to say as an example of what good looks like in my mind, that's how you start to get the message out on policy.
Love these possible opportunities. So to kind of, as we are kind of closing up with 5, 6 more minutes, I'm wondering, like, could you all share, like, what's your call to action for the next generation to achieve our vision of a more equitable future?
Okay, I guess I'll go first. I think it's just, I'm going to sound like a beating the drum here, but again, this is how policy gets done. This is how, change happens. For me, I represent the rare disease community, making sure that we are not left out of the conversation as a community is extraordinarily important, right? And so I think that goes across the continuum. So my call to action would be for not just a next generation, but for us all here is to keep the patients and the communities at that epicenter. We say that a lot in rare, we mean it in rare, not that other groups mean it less, but it just hits differently for us. So representation is important. I know we've used the word equity a lot here, but it's about representation, not as an aspiration, but the responsibility. And you do have to be persistent about it to make sure that the science and the research, I'm just going to give a shout out to like all of my rare disease patient advocates who are fighting for their families. And, they didn't give up when there wasn't a treatment available. They said, okay, we're going to figure this out and become scientists on our own and develop an asset for ourselves, for our community. And there are a number of examples where that's worked. So, look at who's missing from the equation when you're going down the road of science and when you're going down the road of thinking about who's not being heard and how can we do better in that way. Just, how to stay committed to building a future where representation is lived experience. And, just I think in rare, it's a great example, but sorry to beat the drum, but, these are my peeps and I got a shout out for them. So.
No, I mean, I completely agree with Tamar's point. And, for me, one call to action is, that I like to always kind of give to people is just that be brave, continue to be brave. We know that equity is a bad word right now in many circles in the politics. I try to stay, to Malaika's point is I try to stay apolitical as needed or as necessary because it doesn't matter who is affected. What matters is that you are affected, right? A therapy needs to be created for that person that is affected. So that one voice in the back alley, 100 seats back, wants to say something, let that person say something. So you have to kind of come into these venues and really be able to come in and just say, hey, I want to do something too. And just like some of the Q&As out that, we saw here, continuing to do that is certainly going to be I want that to be commonplace so that we can continue to have these open forums and think about how the science help generate policy changes and social changes that are needed because I think it all works hand in hand. There's not one without the other, and I think if we continue to think through that mechanism, I think we kind of create the next generation of those thinkers that build upon that foundation.
I don't know how to follow my great panelists here, but I'll try. One of my favorite quotes or philosophies is just a rising tide lifts all boats, right? And so I think it really is Tamar's point about this current generation investing in the one before ahead of us. And so how do we build those connections and inspire them to pursue their passions? Some of the coolest experiments have happened for people leaving into their personally lived experience. And so when we build those opportunities for them to lean into their curiosity, we are also creating a better community for all of us. And so how we can integrate that into our everyday work and giving back some time, community service is a great place to start. And my call to action is also to be courageous and to speak to what you're experiencing and to let people know the great work that you're doing across STEM.
Awesome. Thank you so much for all these sharing. And a kind of a little bit follow-up question, because after calling to action, as the title of our panel today listed, equity is a long fight in science. So could you quickly share how, like, what keep you personally motivated to stay in the fight? Maybe just a concept or a mission.
For me, it's easy. It's, our patients. Every time I meet one, or run into one, like I was at, the Massachusetts Health Council event, and a patient advocate was there, unbeknownst to me. And just, every time I see someone in the community being vibrant and living their best journey, that keeps me motivated and gives me the opportunity to continue to shout from the rooftop, to be a rare advocate and champion.
I kind of have the same experience. I'm really lucky that I get to interact with our young people in STEM. And so I went to the National Science Club for Girls, had a rocket launch this summer, and seeing the impact of the work that we're doing really just sustains my energy and my commitment to this fight. So I guess I'm a little bit lucky because I got to play with Legos the other day as well. So I try to build in fun interactive experiences, and that makes the work all the more wild.
Yeah, I mean, and the same for me. It's not just generally for the patients, but also being able to express science in a way that sixth graders, eighth graders, 10th graders can understand. Because I actually tend to go through circuits and talk to community colleges and talk to institutions here about the next generation of people who want to be in this space, right? And I go to like Lowell, Lawrence, Worcester, and all these locations that it's like, man, I haven't heard of you guys before. I haven't seen someone like you guys before. It's that excitement that I get that these next generation want to be able to do something moving forward. So they don't have to necessarily be the car shop owners, or now that's not a problem either. I mean, I need a mechanic myself right now. So not an issue with that, but I want to be able to see more generational changes around thinkers, right? Around those who actually want to help create science, so that Alexion has a pipeline of people, and Malaika's
Yeah.
group has a pipeline of people, and even my team has a pipeline of people, and even Oliver's team from Nucleate has a pipeline of people, right? So that we can end disparities, right, for science, and we have them thinking that they can jump in and really say that I can actually conquer cancer. Because if we can have that type of emphasis for those who want to continue that fight, we should give them the road to do it.
Beautiful. Thank you all for sharing such grateful insights. And we're honored to have you. Like, thank you again to you all. And con keeping up the momentum, I'm going to pass the mic to Oliver to kick off our last fireside chat.